Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, let me ask you something. What if your thoughts, your emotions, even your gut feelings aren't just coming from your brain? What if your actual heartbeat is playing a huge role? And I mean, like, pulse by pulse. This isn't poetry. It's this radical new scientific idea that every single heartbeat is tied to your psychological state, happening, within milliseconds.
It's a huge shift, really. For so long, we've kind of treated the brain and the heart like separate departments in the body.
Right. Like one's the CEO and the other's, I don't know, in the mailroom.
Something like that, yeah.
Yeah.
But this new way of thinking, this integrated brain-body framework, it forces us to see them as one system, tightly integrated.
Exactly. So that's our mission for this deep dive. We're digging into this concept of integrated brain-body states, pulling from the latest neuroscience research. We want to unpack how this continuous conversation between your heart and your brain shapes, well, pretty much everything, your daily experience, your long-term health, even your risk for diseases.
Yeah, and we've looked at some pretty technical stuff. A key review in Trends in Neurosciences, for example. Yeah. But also some articles that break it down more simply.
Right, so hopefully we can make it clear for everyone listening. We're aiming to give you the shortcut on some really exciting cutting-edge biology.
Okay, so maybe we should start with the problem this whole idea is trying to solve.
Good idea. Like, why did we need a new framework?
Well, researchers have known for ages that cardiovascular diseases, think high blood pressure, heart issues, and mental health problems like depression or anxiety, they show up together really often, like surprisingly often.
Yeah, they co-occur a lot.
Exactly. But the explanations were always a bit incomplete.
It was usually like, okay, you got diagnosed with heart disease, so of course you're depressed.
Right.
Or the other way around.
Precisely. You're anxious, you don't take care of yourself, you smoke, you don't exercise, and that's what causes the heart problems.
Yeah.
It was always treated as A causes B, or maybe B causes A.
A simple chain reaction.
Right. Unidirectional, or maybe bidirectional, but still treating the heart and the mind as separate things influencing each other. It kind of missed the deeper underlying physiological connection.
It didn't really account for the subtle stuff happening before a diagnosis, did it?
No, exactly. And it needed sort of separate explanations for how something like chronic stress could impact both systems independently.
Okay, so how does this integrated brain-body framework change that picture?
It flips the script. The core idea is that basically any physical change, a heartbeat, a shift in blood pressure, a change in metabolism, automatically, instantly comes with a mental or psychological change. They aren't separate events. They're two aspects of the same event.
Whoa, so they're inseparable.
Inseparable dimensions of one integrated state. It's not cause and effect between two things. It's two readouts of the same system changing.
Okay, that immediately makes the high co-occurrence make way more sense. It's not a coincidence, then.
Not at all. It suggests there are potentially two different symptoms popping up from the same underlying system going awry. One of the researchers behind this used a great analogy of the iceberg.
Okay.
The fact that we see diagnosed mental illness and diagnosed cardiovascular disease together so often, that's just the tip of the iceberg.
So what's underneath?
Underneath is the finding that mental illnesses always seem to have some measurable cardiovascular component, even if it's subtle, not yet clinical. And the reverse is true too. Cardiovascular problems always have a psychological dimension. The link is deep, fundamental.
It's all connected below the surface. That really shifts things from just looking at symptoms to understanding the whole system.
Exactly. And to really grasp this system, we need to think about time. Because this heart-brain conversation, it's happening on multiple different clocks all at once.
Right. The researchers talk about different time scales. How do they break that down?
They use a dynamical systems approach, but maybe a useful analogy is the body's band.
Okay, I like that. The body's band. Who's playing what?
Well, think of the heart as the drummer. It's laying down the fundamental beat, the rhythm systole, the contraction, diastole, the relaxation, thump, 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 thump.
Got it. Heart's the drummer. So who's the singer? Or maybe the sound engineer?
That's the brain.
Yeah.
The brain is constantly listening to that rhythm, processing it, reacting to it. It's using this kind of sixth sense called interoception.
Interoception, that word keeps coming up. That's our ability to sense our internal body state, right?
Exactly. Sensing your heartbeat, your breathing, your gut feelings. It's how the brain monitors the body's internal landscape.
How does that signal actually get from the heart, the drummer, to the brain, the control room?
There are specialized sensors, particularly baroreceptors in your major arteries.
Yeah.
They detect the pressure changes with each beat.
Okay.
And they send this information shooting up to the brain, primarily through pathways like the big vagus nerve.
And where in the brain does that signal land?
A key area is the insula, sometimes called the hidden island because it's tucked away deep in the brain.
The insula? What's its job in this?
It's like the translation center. It takes that raw physiological data, heart rate, pressure, and integrates it with emotions, thoughts, decisions. It turns a faster heartbeat into the feeling of excitement or maybe anxiety. It translates the physical signal into subjective experience.
Okay, so we've got the heart drumming, the brain listening via the insula. Now tell us about those time scales. You mentioned 3.
Right. They categorize them by duration and how easily they change. First up are the microstates.
Micro, so fast.
Very fast. Seconds to minutes, and they're easily reversible. Think of a flash of anger, a wave of joy, a sudden pang of pain, or even that instant gut feeling you get when making a quick decision. These are the immediate, fleeting brain-body states.
Wow, okay. Happening all the time then. What's next?
Then we zoom out a bit to mesostates. These last longer hours, maybe days.
Mesostates, like a mood, or being stressed out all afternoon.
Exactly like being stressed all afternoon. Acute stress is a perfect example. Your cortisol and adrenaline levels might be up for hours. That's a mesostate. Other examples could be the different phases of the menstrual cycle or just the daily ebb and flow of your circadian rhythms.
And what's the effect of being in, say, a stress mesostate? Does it change the microstates?
It absolutely does. A mesostate temporarily limits the range of possible microstates. If you're in that stress mesostate, your emotional flexibility narrows. You're maybe more likely to experience anger, microstates, less likely to feel joy. Problem solving feels harder. It sets the stage, temporarily.
Like putting a filter on the music for a while.
That's a good way to put it. It's a temporary boundary. Then finally we get to the macrostates.
Macro, so the really big picture.
Months, years, even decades. These are the long-lasting, often much harder to reverse states. They can be due to structural changes in the body, think aging, or the stiffening of arteries and chronic disease.
So things like diagnosed depression or long-term hypertension would be macrostates.
Exactly. Your genetic predispositions are a kind of macrostate too. They define the absolute outer limits, the overall state space within which all your micro and mesostates can operate. They represent the long-term structural and functional baseline of your integrated system.
Okay, let's jump back to the microstates for a second, because you mentioned something about the heartbeat itself influencing perception within a single beat. That sounds wild.
It is pretty amazing. We're talking sub-second effects here. Each heartbeat has 2 main phases, right? Systole, when the heart contracts, pressure is high. And diastole, when it relaxes, pressure is lower.
Okay, systole high, diastole low.
Research shows that your perception of the world actually differs between those 2 tiny moments.
How? Like, if I touch something, does it feel different depending on where my heart is in its cycle?
Believe it or not, yes. Studies show things like pain perception and even the feeling of simple touch are reduced during systole, that high-pressure phase, compared to diastole.
Reduce pain when the heart contracts. Why?
The thinking is that the pressure surge during systole activates those baroreceptors we talked about. They signal the brain, which momentarily seems to turn down the volume on incoming external sensory information.
Like the body's saying, hold on, major pump happening. Let's quiet the external chatter for a millisecond.
Sort of, yeah. It's incredibly efficient. And it doesn't just affect sensation. It affects action, too.
Oh.
Motor readiness, like how quickly you can initiate a movement, seems to be higher during systole as well. This gives real physiological teeth to ideas like the somatic marker hypothesis, the theory that our bodily states, driven by things like heart activity, actively guide our choices.
So the heart isn't just reacting, it's actively shaping our perception and readiness to act, beat by beat. But the brain can still tell the heart to speed up or slow down, right? It's not just bottom up.
Oh, absolutely. That's the top-down control. Your brain uses the autonomic nervous system constantly. Sympathetic signals, fight or flight, ramp up heart rate when you're excited or scared. Parasympathetic signals, rest and digest, slow it down when you relax.
It's a continuous loop.
Exactly. That constant, rapid back and forth is the integrated brain-body state in action.
Okay, let's rehook here because this is mind-bending. It means things like how much pain you feel, how fast you react, maybe even how you process complex social cues like stereotypes. All subtly modulated by your cardiac cycle from one pulse to the next.
That's the implication, yes. And this was from a huge study, the UK Biobank. They found that people who eventually were diagnosed with hypertension actually showed signs of lower well-being and more depressive symptoms. 5, even 10 years before their blood pressure officially crossed the clinical threshold.
Wow, so the mental health dip wasn't a reaction to the diagnosis.
It looks like it was a precursor. Part of the system already becoming less healthy, less flexible, years earlier.
So the body was already struggling.
That's the idea. The researchers talk about a maladaptive equilibrium. It's like the person's overall brain-body state becomes so constrained, so stressed, that it actually needs a higher blood pressure just to function somewhat normally to maintain cognitive focus or emotional stability at a level comparable to someone healthy.
So hypertension could be seen as the body's costly, inefficient way of trying to keep things stable when the underlying system is failing?
In this view, yes. It's a compensation, but a damaging one long-term. Less a plumbing problem, more a system dynamics problem.
Okay, what about depression then? Often seen as purely mental.
Well, the evidence powerfully suggests it's not purely mental at all. A common finding in depression is reduced heart rate variability.
Heart rate variability. And that's how much the timing between heartbeats varies, right?
Exactly. A healthy heart doesn't beat like a metronome. There's constant, subtle variation. Reduced variability means the system is more rigid, often stuck in a stress-like response. It's less adaptable.
And you see this reduced adaptability in depression even without a formal heart disease diagnosis.
Absolutely.
Right.
And crucially, this link lower heart rate adaptability, sometimes alongside slightly elevated blood pressure, even if not clinical hypertension, shows up even in kids and teenagers with depression. It highlights that the cardiovascular component is there, woven into the depressive state itself. The mind-body split just doesn't hold up.
This really leads to a core hypothesis, doesn't it? That subtle differences in how well your specific heart and brain communicate, how integrated they are, could actually predispose you to developing diseases we used to put in totally separate boxes.
That's the big takeaway, yes. It suggests a common underlying vulnerability. And, importantly, the researchers point out this isn't just about the heart.
Ah, so it's a starting point.
Right. They explicitly say the framework should eventually include other major systems too. The immune system, the respiratory system, metabolism, I think the gut-brain axis, they're all part of this dynamic integrated state. The heart is just a very prominent, measurable part of it.
Okay, so wrapping this up, what's the main message for listeners? What should we take away from this deep dive?
I think the biggest synthesis is that your mental health and your cardiovascular health are not just linked. They're fundamentally interdependent. They operate together across all these timescales, the quick microstates, the medium mesostates, and the long-term macrostates.
Which means we really need to stop thinking about treating the mind or the body.
Exactly. Prevention and treatment need to address both domains together, simultaneously. We need to support the whole integrated system.
Okay, so the call to action then. What can people listening do? If the system needs to be flexible and communicate well.
It brings us back to some familiar advice, but seen through this new lens. Things like regular exercise, getting enough good quality sleep, techniques for managing stress or promoting relaxation.
These aren't just good for you, vaguely.
No. In this framework, they are ways to literally strengthen the communication pathways between your heart and brain. They enhance the system's flexibility, its dynamic range. They make it harder for your body's band to get stuck in those rigid, unhealthy macro states.
You're essentially tuning up the entire system, helping the drummer and the sound engineer stay in sync.
That's a great way to put it. Restoring healthy dynamics, one heartbeat at a time.
All right, so let's leave everyone with a final thought to chew on. If your ability to sense and interpret your own internal signals your interoception, listening to your body is key to resilience. How well are you actually listening to your body's drummer right now? What subtle messages about your overall state might you be missing?
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.